The spirit of discovery that advances science is the same one that uncovers the mystery of existence. The study explores a critical gap in our understanding of the physiologic effects of high-flow nasal cannula, HFNC, and helmet continuous positive airway pressure, CPAP, in patients with acute hypoxemic respiratory failure, AHRF. The primary objective was to compare these interventions against conventional oxygen therapy concerning respiratory mechanics, inspiratory effort, gas exchange, and hemodynamics. This crossover study encompassed 33 adult patients within the ICU setting, characterized by a PaO2 less than 60 millimeters of mercury, or a PaO2-FiO2 ratio below 300, and a PaO2 below 45 millimeters of mercury. Patients underwent sequential application of HFNC at 60 L-min and helmet CPAP with PEEP set at 5 or 10 cm H2O, each following baseline COT. The primary endpoint focused on changes in tidal volume, respiratory rate, and arterial blood gases 20 minutes post-application of each device.
Quick take. This ICU-based crossover study evaluated HFNC and helmet CPAP versus conventional oxygen therapy in 33 AHRF patients.
The findings revealed that both HFNC and helmet CPAP at 5 cm and 10 cm H2O significantly diminished minute ventilation and inspiratory esophageal pressures while enhancing PaO2-FiO2 ratios relative to COT. Notably, helmet CPAP at 10 cm H2O did not lower inspiratory effort indices or improve oxygenation and led to suboptimal mechanical power outcomes. The study concluded that HFNC and helmet CPAP suffice in moderating minute ventilation and inspiratory efforts while augmenting oxygenation in mild to moderate HRF, with 10 cm H2O of PEEP in CPAP potentially exacerbating mechanical strain. The authors conclude that while HFNC and helmet CPAP significantly improve respiratory metrics compared to COT, caution should be exercised with 10 cm H2O PEEP application in helmet CPAP.
Quick take. Both HFNC and helmet CPAP showed improvements over COT in terms of respiratory parameters, but helmet CPAP with higher PEEP increased mechanical strain.
Short quiz, clinical vignette. Question. A 64-year-old male with acute hypoxemic respiratory failure, PaO2-FiO2 ratio of 250, and PaCO2 of 40 millimeters of mercury, is receiving conventional oxygen therapy. After transitioning to helmet CPAP with 10 cm H2O of PEEP, which outcome measure is most likely to worsen based on recent evidence? PaO2-FiO2 ratio. Option 2, inspiratory esophageal pressure change. Option 3, mechanical power. Option 4, minute ventilation.
The answer is option 3. Recent evidence from the study indicates that helmet CPAP at 10 cm H2O of PEEP does not improve inspiratory effort or oxygenation, and instead has shown to worsen mechanical power, indicating increased mechanical load or inefficiency.